Hello, my name is Jennifer, and today we're going to talk about some common mental health terms and how they're most typically used, and then strategies that we can implement to promote people first language and stigma reduction. To begin, the term behavioral health, it speaks to your overall well-being. It can include all aspects of your life, your health, emotional, physical, how you eat, how you sleep. It can also be used to describe changes in your demeanor. When it comes to mental health, according to the U.S. Department of Health and Human Services, mental health is a person's psychological, emotional, and social well being. Some mental health conditions may be impacted by behavior. Many mental health disorders have neurological and biological causes, which means simply changing your behavior will not cure them of the illness. And this is from projectknow.com. Behavioral health and mental health are often overlapping, and sometimes they can be used interchangeably, but they are different. Behavioral health reflects behavior, which means a person can change something to see an improvement. And as mentioned before, mental health may not improve with just a changed behavior alone. According to the Mayo Clinic, nervous breakdowns can be described as a stressful situation in which a person is temporarily unable to function normally in their day-to-day life. Also mentioned is that a nervous breakdown is not a medical term, nor does it specify a mental illness. This term is most often used to describe when a person is overwhelmed and unable to cope with their stressors of life due to burnout, lack of sleep, maybe poor nutrition, and it affects their everyday life functioning. Emotional problems, change in emotions can be something that we all experience. We all have a range of emotions that we go through every day, every week. But when it becomes a problem is when someone would experience a variety of emotions throughout their day, but they become persistent, disproportionate, extreme, persistent, or unstable. Emotional problems could be on either end of the spectrum, happy, sad, things like that. It's just extreme one way or the other. Emotional problems can also make it difficult for people to form relationships with other people due to their ranging of emotions that they can't control. The term emotional problems is most likely used to describe some sort of maybe behavioral mental health issue or concern, such as anxiety disorders, bipolar disorder, and a common one is dementia, which is used with the older population. Emotional problems would be like describing something that a person is going through. So when it comes to strategies to implement to promote people first language and stigma reduction, the first thing that clinicians, social workers should do is not use labels. As a social worker, one of my old professors used to always tell me social workers have to be intentional with the words you use, especially when you're speaking about your client. So being intentional, not using words that carry stigmas, and then not using stereotypes or labels when documenting or speaking to your client. Use a person-first language. If you have a client who's experiencing PTSD or they were diagnosed with PTSD, you would want to use that person-first language and say, Joe is here today experiencing PTSD symptoms due to X, Y, and Z. Keep your language person-centered, always about the client that you're there with, not necessarily the diagnosis. Embrace positive changes with treatment or in behavior. Continue to educate your client. Sometimes, clients will come and they make small progress with their treatment, or just even thinking about starting a treatment, especially as it relates to medication. Embracing those small changes that are positive with your client and encouraging them to continue. Be aware of your unintentional bias, as that could affect assisting your client, especially as mental health treatment for different cultures can still be considered taboo and not something that necessarily all people believe in. So just normalize mental health and treatment, and just work with your client where they're at and embrace the change. Thank you.